Hello, and thank you for joining us today. I'm Bruce Goldstein, President of Farmworker Justice. Welcome to the Facebook series of Farmworker Justice, the state of farm workers in the COVID-19 era. Farm workers have been designated essential workers to ensure our nation's food security during the COVID-19 pandemic, yet their working and living conditions create grave risks to their health and to their economic status. These programs raise awareness about the serious challenges the pandemic imposes on farm workers and their family members each and every day. The series identifies impactful work and innovative ideas being carried out by Farmworker Justice and other organizations that represent and serve farm workers. This is the beginning of the third week of our interview series. We now have 10 videos that are posted on our Facebook page. We also have information posted on the Farmworker Justice website, www.farmworkerjustice.org. Just today, in fact, we posted an update that we issue every few weeks on immigration, labor, and health issues. So let me welcome our guest, Chet Hewitt. Chet, welcome.
Thank you, Bruce. Glad to be here.
Well, it's our pleasure. We really appreciate it. So Chet Hewitt is the president and CEO of the Sierra Health Foundation, a California-based philanthropy. And it's also of its nonprofit intermediary partner called the Center at Sierra Health Foundation. Over the past decade, Chet has led bold, collective, impactful strategies focused on promoting health and social justice in underserved communities. And we asked Chet here today because we'd really like to hear from him as a longtime leader in the philanthropic world about what philanthropies are doing, can do, and will do to help farm workers, their families, and their communities. So again, thank you for joining us, Chet.
Yeah. Well, as I said, Bruce, really happy to be here to talk about an important issue.
So please tell our viewers what the mission is of the Sierra Health Foundation and what are its main activities in general.
Mm-hmm. Sierra Health is a health-focused foundation, as you said, but our approach to health has really been around the social determinants of health. And that is the things in your life that actually promote wellness and prosperity, as much as we've been focused on things that you need when you are ill. And when you're ill, you need health care. And we believe everyone, regardless of your status, should have access to high quality health care. But we also know that 85% of a person's health is really about the places they live, their access to opportunity, the environment in which they live, and their ability to have the kind of nutritional and other supports that actually allow people to prosper. And for Sierra Health, that has been the primary focus of our investments over the past decade.
And when you say investments, what does that mean? How does the foundation invest?
Well, for us, we would say grants, but we believe that the strategy of investments is better language, and not because it comes out of the business sector, but we're investing in communities and people and ideas to actually advance this notion of health, well-being, and social justice. We don't talk a lot in Sierra Health about our grants. I often say that if you want a grant, there are many institutions to talk to. If you're looking for a partnership, you should come and talk to us. And while it may seem like it's just semantics and language, we think how we think about our partners, the language we apply to those we actually work with, actually says a lot. It actually describes and creates a sense of agency amongst the groups that we invest in that suggests the power dynamic, the unequal distribution of power often between foundations and those that they give resources to, is lessened. And when we're clear, it doesn't mean that it goes away. I mean, it's, kind of is what it is when you're giving away financial resources. But we believe that, we need to think about the value those partners bring to the work, which is as essential to the work as our money is.
Thanks. And you've come to your ideas about the role of philanthropy through years of working in the area, but also working in the field. How about telling our listeners a little bit about your background and how you came to the Sierra Health Foundation?
I've had the pleasure being in philanthropy on 3 different occasions now with 3 different sets of responsibilities, but also, as you know, Bruce, a history working in the public sector as well. Humble beginning, one of 8 children, grew up in the public housing developments of New York, so the experiences around poverty and not having all that one would need and desire is not new to me. Began as a community organizer in San Francisco, law school, and then on to doing work at the Center on Juvenile and Criminal Justice around criminal justice reform in the late 90s. First trip back east to a large foundation in Baltimore, and then on to Rockefeller Foundation in New York, before coming back to work in the public sector. Formerly ran Alameda County, which is one of the large counties here in California's social service agency, and then left that and came back into the world of philanthropy. So been in and out of the sector multiple times. I actually think it's a good journey to actually have. You get to see both sides of the equation, what the public sector does, how philanthropy can add value to the work and outcomes that we're really committed to, and then always those community organizing roots and lived experience in many respects that always brings me and keeps me close to the work and communities in which we're investing.
Thanks. And we were fortunate to meet some years ago through a mutual colleague. Our late chair of our board of directors, Mario Gutierrez, introduced us some years ago. So we met way back when. So what has the foundation been seeking to accomplish regarding farm workers before the COVID-19 pandemic began?
Well, I'm really glad that we're starting in that place, because about 6 years ago, we started the San Joaquin Valley Health Fund, which was our effort to really focus on what was going on in farm working communities in Central California. And as you know, California is known for its innovation and a certain lifestyle and a progressive set of policies and a political environment, and that is very true along the coast of the state, in which you see a lot of activity around those ideas as well. And there's a very different story as you move inland. And so as I moved from the Bay Area and moved to the foundation and did my initial tour, took some of the things I had been reading about and really gave them a more vivid image, an up close and personal experience to the difference in opportunity, infrastructure, and ultimately the impact on immigrant and farm working communities, which are essential to the state's economy. This is not some marginalized activity when you think about food production in the state of California, given its well-known Central Valley and the food bastion of America. And so that led us to really start thinking about our social determinants of health lens, and how did that really apply in an environment where 1 in 4 schools you can't drink the water because it's contaminated, or you have whole communities where folks have to actually purchase water because you can't use your groundwater. Some families spending up to 10% of their disposable income to purchase water. But every day go back out as one of those essential workers to the fields to make sure that America is fed, when they themselves have some of the highest rates of food insecurity in the state of California. So this real disconnect between these high ideals and the lived experience of many communities in Central California. So we started this fund to really attract investors, other foundations, to 1, become much more aware of these conditions, and 2, to really begin to build a power base to address their effects, but also to kind of build the kind of public policy constituency that can change some of the drivers to those conditions as well.
Yeah, that's great. Our mission at Farmworker Justice is to empower farm workers to improve their living and working conditions, to give them tools and to support them so that they control their own destinies, rather than just deliver some services to them or file a lawsuit or lobby here and there on some policy. We try to give them the resources and knowledge and skills that they need to speak for themselves. And that applies to the work we do in the communities, in the workplaces, in federal agencies, and in the US Congress. So let's turn to what the Sierra Health Foundation has decided to do in the way of assisting farm workers and their families and their communities during the pandemic and in response to COVID-19.
You know, well, we've built off the work that I just described previously for our San Joaquin Valley Health Fund, because many of the groups that we were supporting, doing our power building investment work with, are the same groups we're working with in order to address the pandemic. And while many of them are focused on water or air quality, pesticide exposure, food access, we also know that we chose them because they have authentic relationships with individuals and families in farm working communities as well. And so we have begun to leverage those relationships in new ways. For our San Joaquin Valley Health Fund, it was really focused on an empowerment strategy around policy and systemic change, dealing with the root causes of inequities. In the pandemic, it really is shifted to the delivery of essential services to families, many of whom are locked out of the kind of public sector responses that we've seen today. Whether that's issues around, CARES Act funding and special grants to families, which many of our farm workers are not eligible for. Even if you are in a mixed documentation family, you're ineligible for some of those benefits as well. Clearly, many are not eligible for some of the food and nutritional benefit programs, the income support programs in the state of California, despite the kind of progressive politics. And our attempt to do as best we can with state-only resources to meet those. But we knew that the pandemic creates a shock to a system. Issues that we found to be worrisome and challenging have now become more acute. And so our initial response was to meet those needs as they were articulated to us by the groups that we have been working with. And this is what I talked about earlier about the balance of power. It's less about how the foundation believes it should respond and more about how the partnership the foundation has with its grantees, the folks we invest in, its partners, and what they're seeing on the ground and what they actually inform us about what we should be doing. And so what does that look like? So we launched the Donate for San Joaquin Valley Health Fund. We have about 10 funders who have come to the table with us. We've raised about $3 million, which we are distributing for direct support to help with rental payments, with utility payments, and things you need cash for in families. We are working with groups to distribute food boxes to families directly to help support families purchase water. Because we know how important it is, not just to have water on a daily basis, but in the course of a pandemic, to wash your hands, to clean your clothes, to do the kind of public health protocols that keep us safe. So right now, we're really focused on kind of meeting the immediate needs, basic needs that farm worker families actually have.
Yeah, that's really helpful. We, on the policy side, we work with groups all over the country, including many groups in California, where about a third of all of the nation's farm workers are living and working. We do a lot of work at the federal level, but basically there's been an absence of leadership in the Trump administration regarding the most vulnerable workers in this country during the pandemic. So we've been trying to be helpful to the state level advocacy by farmer organizations and their allies around the country. But some of the states can't solve all of the problems because some of the issues are really federal in nature. One of them is immigration policy. So Congress has passed some beneficial policy changes and given money for certain projects, but undocumented immigrants have pretty much been left out of those. And yet They're calling farm workers essential workers, as they should, but a majority of farm workers are undocumented immigrants. And so the programs that they're, and the rights and the procedures and the safety protections they're creating are not often reaching these essential workers. And unfortunately, in a lot of states, there's not the political will or moral backbone to be helpful to farm workers. California does kind of stand out in that regard. So that's what I want to follow up with you on. Is it seems like California is, the governor and the legislature are being collaborative and listening and trying to be helpful in ways that the federal government and most other states are not.
Well, you know, as a former county social service agency director, I understand this pretty well, as you know, Bruce. Eligibility criteria for programs that have federal resources are just not available to farm workers or undocumented, and even some limited illegally families who are here illegally because of things like public charge, out of the fear of what it actually means if you go out and seek a benefit that you might in fact be eligible for. So against this backdrop of being an essential worker, you also have the environment that is just really not supportive of giving essential workers the tools that they need to go out and conduct that essential work, right? You've got to be healthy, and that's about your access to a safe environment, good housing, food, nutrition, and water. And I keep bringing up water because it's kind of embarrassing in America to be talking about folks who don't have access to clean, fresh, affordable drinking water. But that is the case in many farm working communities. And so, you know, while California does a lot better, we have a governor who I believe is very sensitive to these issues. We have a legislature that by and large is sensitive to these issues, but it's hamstrung by the kind of federal policy frameworks which limit what they can actually do. We also believe this will be exacerbated by the constraints of state budgets, given that many of those budgets are really those budget and the coffers that fill our ability to spend money are impacted by the pandemic and the economic slowdown. Right? So you have kind of forces working against our capacity to actually do well. And so the federal government is an essential part of that network of supporters and providers, that governance body that needs to work in better alignment in order to ensure that farm workers have the tools that they need and deserve. You talked about the moral component of this particular work. And I do think while, you know, policy and politics often shape what we do here in America, that there is a moral component to this, because farm workers are not just individuals working in agribusiness. They are mothers, they are fathers, they are young adults, they are children, and they deserve to have all the protections that anybody living in this country has afforded to them.
Thanks. I'd like to return now to the role of philanthropies. You discussed the limitations on government budgets. I mean, collectively, foundations have billions of dollars that they spend, but in a sense, those are limited resources too. So I'd like you to tell our listeners, especially for some who are not that familiar with philanthropy, kind of the limitations on what philanthropies can do, and what should be the highest priorities in the pandemic given those limitations, as well as the resources that they do have.
You know, foundations, by and large, are institutions that have a corpus, a amount of money that they invest. They seek returns on those particular investments, and then they make grants, investments in non-for-profit entities to carry out the mission of that particular foundation. We're a health foundation. We focus on health. There are others who focus on education or other issues that are in the social good, public charities working for social good. By law, foundations are supposed to distribute 5% of their total assets, through their investments, through their grants, to the nonprofit sector. That's basically what's happening or how philanthropy, operates. I think there are two things that I would say to my colleagues, and there are many conversations going on about these particular issues. One is, we need to think about spending more than 5% of our resources, this year going forward. And there's huge debate about, how and whether and what conditions would give rise to that being something that foundation would embrace writ large. Many foundations are actually doing that. That is an upside. I really do applaud those institutions who are looking beyond that 5% minimum spend limit. But I would also say that if you are waiting for a moment in time where more needs to be done, I could not think of one that would have kind of a greater merit for doing so than the times that we're actually facing now. This really is a once in a lifetime event, and hopefully we'll come out of this not simply having survived the pandemic, which of course we all want to see happen as soon as we can, but we also want to be smarter and better prepared for a new future, going forward. And I think foundations can help set the tone, set the table for that to happen. I had a colleague say to me the other day, Chet, there'll be a new normal. And I said, not necessarily. Because in times like this, the past always seems a little bit better than it probably really was. There's a reason why we have the saying, the good old times. We don't need the good old times. We need a prosperous new time going forward. And that's got to look very, very different. So for me, foundations have to continue to build on their power building strategy, because good policy without a constituency is really shelf material. Lots of great reports we've seen, lots of great ideas, but didn't get very far because they don't have the kind of backing, people standing behind them to give great pause to the legislative and political sector relative to their ability to avoid some of the things that we know that they should actually do. And I think, this is a time when we can help build that power. There's a reason why we are using the same power building groups to do our basic needs distribution. One, because they have real connections. They are authentic and trusted institutions within those communities, but we know they're also demonstrating their ability to bring people together to resolve issues. And we'd like it to translate beyond the immediate needs focus that we have right now to the power building and policy change and social justice agenda that we need to deepen going forward. I want to say one other thing, because sometimes people hear this and they think, Chet, you're being critical of the sector, and I'm not being critical of the sector. That's not my intention. It doesn't do anything. What I hope I'm being is inspirational and giving people a little bit more wiggle room to do something that the sector does not do very often, and that is invest at a level and a depth to actually make the change happen. And I think that would be a big take up for foundation. It's not as expensive as all the service delivery, but its long-term effect on the lives and livelihoods of farm workers and the poor in America could be extraordinary. Sorry for going long. I've been thinking about this. As you can probably
that's why we have you on, because you've been thinking about it. And part of the purpose of this video series is to raise awareness about the role of farm workers in this country and about the disadvantages that they experience already, that discriminated against in labor laws all over the country. This country has allowed our immigration system to get broken. And one of the consequences of that is it's allowed a lot of people to perform farm work who don't have any papers and can be exploited by their employers because they're so afraid of being arrested and deported just for speaking up. So what we're hoping, though we're very much focused on the short term during this pandemic, we are hoping that by the government, by the federal government, by the state governments, designating as an official matter that farm workers are essential workers and need to keep working during this dangerous time in this critical infrastructure sector of food and agriculture, that they will then be treated in the future as essential workers and frankly just be treated better. Not try to take advantage of the fact that there are poor people in foreign countries who are so desperate that they'll come to work here almost under any conditions. That is the definition of exploitation. It is taking advantage of somebody's disadvantages. We need to stop doing that, and we're hopeful that this crisis creates an opportunity down the road for farm workers. So
well, I couldn't agree more, Bruce. We know the idea of an essential worker. I would ask folks who may not be as well informed about the contributions that farm workers, farm working families and communities make to our lives and livelihoods. Because isn't, sometimes we talk about this as if it's simply about our kind of moral direction and belief around treating people fairly. And that's sufficient for many of us. But I would ask people who don't think about this, about how they feel when they walk in the supermarket and there is no food in the freezer. How you feel when you don't see meat in the freezer, or milk, or toilet paper, or any of the other things. Think about the level of anxiety and stress that makes in an average American's life. And so this notion of essential isn't just simply a tagline, right? Doesn't just mean they can go to work in the time and whereas everyone else to stay home. No, it is part of the lifeblood of all of our communities that deems it essential. And if we value what it delivers, then we should value the people who deliver it. And everything you talked about, from the conditions in which they work, to the conditions in which they live, to the conditions in which their children get to be part of this American landscape, all those things should be held up and honored in ways that suggest that we would invest in those communities and what they actually need, and think about them as in the same way that we think about the communities in which we may live as individuals.
Well, we appreciate
more complicated than that. Now, the politics is always complicated, but how and the why for many of us is really not all that complicated. They are essential workers doing an essential function to help keeping the lifeblood of America going.
Well, we appreciate your voice in the philanthropic world. We know that there's a few others, but we're hopeful that there'll be more of a groundswell of support for farm workers going forward. So thank you. Let me tell our viewers that farmworkerjustice.org, our website, does have substantial amounts of material about COVID-19, about health of farm workers, about occupational safety, about immigration policy, labor rights. We have an update that comes out every few weeks. We just posted on our website today. And Farm Worker Justice does its work with and on behalf of farm workers through the generous support of philanthropies and individuals like the people watching this program. And we don't charge farm workers for our services, never have, never will. So we hope that you will make a donation to Farm Worker Justice. You can do that on our website, farmworkerjustice.org, or mail a donation to our address in DC. And we also right now have a matching challenge grant. So if we raise $30,000, a generous donor will give us $30,000. So help us meet that match. We'll be broadcasting each day this week. Tomorrow, Tuesday, we will have Reina Lopez, who is the executive director of PECUN. It's the Oregon Farm Workers Union, very dynamic group that is active not only in Oregon, but nationally. And we have other great guests coming this week. So Chet, I really appreciate your being on and helping us today. Any closing words for us?
Well, let me just give a shout out to Farm Worker Justice, Bruce, for the incredible work that you do, and encourage folks who are listening in on this broadcast to support your necessary work. And then a shout out to our potential new partners in the San Joaquin Valley. Go to the Sierra Health Foundation website, click on the center. There are opportunities for us to invest in the work that you're actually doing. We love growing our partner base. If you're an authentic, community-driven group who's interested in both policy and social change, understands the importance of delivering direct services, we'd like to explore the opportunity to help you do that particular work.
Great. Thank you so much. See you in the next program.
Take well. Be well.